This video is for general information only and does not replace advice from your doctor or trial clinician. Please speak to your healthcare team before making any decisions about your treatment. How do you know if retatrutide is actually doing something? That's exactly what we're covering today. The signs to look out for, what the early research tells us, and what to discuss with your doctor if you're involved in a clinical trial. So first, what is retatrutide? It's an investigational medicine, meaning it's not licensed in the UK and is only available through approved clinical trials. It's a triple receptor agonist targeting 3 receptors at once: GLP-1, GIP, and glucagon. That combination is designed to reduce appetite and support metabolic function. It's a genuinely different approach to the single or dual receptor medicines we've seen before. Now, how do you know if it's working? One of the earliest and most consistent signs reported in clinical trials is a noticeable reduction in appetite. Participants described feeling satisfied with smaller portions and experiencing fewer cravings between meals. Some also reported less preoccupation with food, overall less emotional or habitual eating. That shift can feel quite significant even before you see changes on the scales. A gradual weight reduction is another key indicator. Based on data from the Phase 2 randomized controlled trial published in the New England Journal of Medicine in 2023, meaningful changes in body weight typically began to appear from around weeks 4 to 8 of treatment. So rather than expecting immediate results, it's worth keeping that timeline in mind. For people with type 2 diabetes or insulin resistance, improved blood glucose levels are also worth monitoring. A reduction in fasting blood glucose, or HbA1c, may suggest the medicine is having its intended metabolic effect. That said, if you're taking insulin or a sulfonylurea alongside retatrutide, improved glucose control can increase the risk of hypoglycemia. Do not adjust your diabetes medicines without advice from your prescribing clinician. That decision must come from your trial team. Speaking of your trial team, they are the ones who set and manage your dose schedule. Do not attempt to adjust or interpret your dosing yourself. If you have questions about your progress or what you're experiencing, bring those to your trial clinician. They'll monitor you through regular weigh-ins, blood glucose checks, or HbA1c measurements depending on your protocol. On side effects, gastrointestinal symptoms like nausea, vomiting, and diarrhea are commonly reported, particularly in the early weeks. These are generally transient and tend to ease as your body adjusts. However, if you experience severe or persistent abdominal pain, persistent vomiting, signs of dehydration, or symptoms of low blood sugar, seek urgent medical attention. In the UK, that means calling 999 or going to A&E. Don't wait it out if something feels seriously wrong. And just to be absolutely clear, retatrutide has no MHRA marketing authorization and is not available outside of approved clinical trials in the UK. If you've come across it being offered elsewhere, please speak to a healthcare professional before proceeding. To recap, early signs that retatrutide may be working include reduced appetite and smaller portion satisfaction, gradual weight reduction typically becoming noticeable from weeks 4 to 8, and improved blood glucose markers in those with diabetes or insulin resistance. Any assessment of how well treatment is working should always be done in partnership with your trial clinician, not based on how you feel alone. If you found this helpful, leave a comment below, especially if there's something specific about retatrutide or other investigational medicines you'd like us to cover. Give this video a like and subscribe to Bolt Pharmacy for more evidence-based health content. We'll see you in the next one.